Hello, what seems to be the problem today?
I haven't been feeling well lately.
Well, what are your symptoms?
Well, I've been having really bad headaches. My neck has also been really stiff lately. It hurts to move. Now that I think about it, my entire body feels really sore every now and then. It's most painful in my joints. There's also sometimes a tingling sensation in my fingers and toes.
Okay, go on.
Well, recently, I've also been experiencing episodes of dizziness. I'm totally fine 1 second, then everything will get blurry and I won't be able to walk for a few minutes. I've also recently had trouble remembering basic stuff, like where I put my keys.
That's really interesting. What have you been doing this past month?
Not very much, just my usual routine. I did go hiking on the Appalachian Trail a month ago.
Okay, well, considering your symptoms that you described and the fact that you spent an extended amount of time outdoors, there's a possibility you were bit by a tick and have begun to develop Lyme disease. Did you have any symptoms immediately following your hike?
Boy, it was a long time ago. I remember feeling fatigued, but I thought it was just from exerting energy on the hike. Now that I think about it, though, I also had a headache, fever, and chills when I got back home. Oh, and I'm not sure if this is important, but I also had a skin rash that looked kind of like a bug bite.
That sounds about right. I'm fairly certain it's Lyme disease, but I'd like to run some tests first.
Sounds good.
Other late symptoms include inflammation of the brain and spinal cord, irregular heartbeat, facial paralysis, arthritis, more erythema migrans rashes. Other earlier symptoms include swollen lymph nodes. Initial lab tests are conducted to test for Lyme disease. These tests are considered indirect because they are testing for antibodies against the infecting bacteria that are produced by the immune response. These tests are most reliable a few weeks after infection. Enzyme-linked immunoabsorbent assays, or ELISAs, are used most often to detect Lyme disease. In this assay, an antigen in the sample from the patient is complexed with an antibody known to match the Lyme disease antigen. An enzyme is linked to this antibody. A substrate of this enzyme is incubated with the antigen-antibody enzyme complex. Detection of the product produced by the substrate and enzyme is used to determine positive or negative results. A second indirect test, such as a Western blot, is usually conducted to affirm the results of the ELISA. Western blots probe for antibodies produced by the bacteria in the patient's blood. This test is similar to the ELISA in that it also uses two antigens in order to detect the presence of the bacteria antibody protein. Another way to test for Lyme disease is by direct testing for the bacteria that causes the disease. One such direct test is polymerase chain reaction, PCR, which can be used to amplify the DNA of the bacteria from a sample from the patient. PCR uses a probe that is known to be complementary to the bacteria's DNA, making this form of testing highly accurate. One downfall to this technique is that it may also provide false negative results if no bacteria are present in the sample being tested. Another form of a direct test is to probe for antigens in a sample from the patient. The gold standard of testing for Lyme disease is another form of direct testing. This culture testing simply takes a sample from the patient and attempts to grow the bacteria that causes Lyme disease on a special medium.
Your ELISA test came back positive, so I also ran a Western blot test. This came back positive as well. These indirect tests suggest you most likely have Lyme disease, so I want to begin treating you for that.
Lyme disease is caused by Borrelia burgdorferi, a spirochete bacteria. It is transmitted by tick bites, specifically from the Ixodes staminii tick species. The tick's saliva protects the bacteria from the immune system. Flagella help the bacteria move through mucus and body tissues. The body can't activate an immune response because the bacteria is protected by the tick's saliva, so instead it activates a non-specific inflammatory response. This response includes dilation of the blood capillaries in order to increase phagocyte distribution to the points of infection. Increased blood flow also releases other chemicals that are the basis for the symptoms such as fever, headache, and rash. The bacteria alters its cell wall protein so that the immune system cannot detect it, since it usually detects foreign invaders by their cell wall proteins. However, the immune response was already in motion. The body continually sends cells into the body to attack the bacteria, but they are unsuccessful at destroying the infection. So the inflammatory response worsens and the body tissues are damaged, such as the skin, joints, and nerves. This leads to the late symptoms of arthritis, joint pains, tingling in the extremities, and further rashes. The brain also launches an ineffective immune response on the bacteria in disguise. The cells it releases can be toxic to nerves in and around the brain. This leads to symptoms of severe headaches due to inflammation of the brain and spinal cord. The bacteria can also produce a biofilm, which protects them from harsh environments such as that provided by antibiotics. This can make antibiotics less successful as treatments if the disease is caught too late. However, if caught in time, they can be highly effective.
I'm going to prescribe you doxycycline, an antibiotic for 14 to 21 days. Pick it up at your local pharmacy.
Thank you, doctor.
Antibiotics can be used to fight the bacteria that cause Lyme disease. Oral administration is standard for early treatment of Lyme disease. Doxycycline is prescribed for adults and children over age 8. Amoxicillin and cefuroxime are prescribed for certain adults, young children, and pregnant or breastfeeding women. A 14 to 21 day course of antibiotics is recommended. Intravenous antibiotics are used if the infection is present in the central nervous system. This method will clear up the infection, but it may take some time to recover from the side effects of the antibiotics. This course of treatment is recommended for 14 to 28 days. Various side effects can result from the use of antibiotics. These include lower white blood cell count, mild to severe diarrhea, and colonization or infection with other antibiotic-resistant organisms unrelated to the Lyme disease bacteria. Antibiotics can also cause continued muscle fatigue after treatment. This is known as post-treatment Lyme disease syndrome. It is unknown why this disease exists, and further antibiotic treatment does not relieve it. It is believed that those who develop this disease are predisposed to develop an immune response that causes muscle fatigue. However, this is not certain and more research is needed. Doxycycline is the major antibiotic used to treat Lyme disease. It cannot be used in children under 8 because it is a form of tetracycline that discolors teeth and inhibits bone growth. It can also cause birth defects if used by pregnant women and can be passed through breastfeeding as well. It can be started 72 hours after the tick bite. Doxycycline can also be used to treat Lyme arthritis and acrodermatitis chronica atrophicaans in the late stages of Lyme disease. One possible side effect of this antibiotic is a higher tendency to develop sunburn. Other antibiotics used to treat Lyme disease include amoxicillin, cefotaxime, ceftriaxone, cefuroxime, erythromycin, penicillin, and tetracycline.